Tooth decay is actually totally preventable. Dentists call it caries, public tends to call it tooth decay, bad teeth. The result of tooth decay is pain, suffering, and ultimately either tooth loss if you can't get to a dentist or can't get treatment, or fillings and complicated dental treatment if you can. Many of your clients can't tolerate simple dental procedures such as fillings without having to have general anaesthetics or sedation, and it puts them at greater risk of something going wrong. So prevention for your clients is uppermost. They should be the top priority. Caries, tooth decay happens when you have a tooth being attacked by sugar and bacteria from plaque. You feed the bacteria in the plaque with sugar. The bacteria use that sugar, and the byproduct of that is to produce acid. This sits on the surface of the tooth and dissolves the enamel. You lose the minerals from the enamel, and if it's in the deep parts of the tooth, you lose minerals from the dentine. The minerals leach out of the tooth, and you end up sooner or later with a hole. Now, under normal circumstances, if you limit these acid attacks to meal times, your body copes really well because saliva neutralizes the acid. We call that buffering, and there's calcium and phosphates and minerals in the saliva as well. If there's fluoride around, which usually comes from fluoride toothpaste because there's no fluoride in the water here, then that also gets put back into the tooth and the tooth can heal. That's fine in the early stages, but if you keep having acid attacks, your saliva can't cope, fluoride in the toothpaste can't cope, and you end up with holes that go through the enamel into the dentine. And once they reach the dentine, then it is painful, and you might find that your client is wincing when they have something very cold or when they have something very sweet or very hot, and that is a reaction and sometimes an indication that tooth decay is starting. Often very worrying when you see that your client has bleeding gums. And some people think that's quite normal, but it isn't. It's a sign of ill health. And the reason that the gums are bleeding is that there's inflammation. And the inflammation is caused by plaque, that's bacteria, food debris. It also causes bad breath. And dentists call this gingivitis, when the gums are swollen and puffy and red and bleed on brushing. If it's very severe, bleeding can happen spontaneously, like seeing blood on somebody's pillow in the morning, or even eating an apple or a bread roll, you'll see blood. And it's quite scary and unpleasant. The only effective way to do this is to remove all the plaque, and that's got to be done by brushing. Just rinsing won't get rid of plaque. It must be physically brushing your client's teeth or getting them to brush their own teeth effectively. Once the plaque is removed, the gingivitis will last for 7 to 10 days at most. The gums will shrink back. Instead of being red and angry and puffy, they'll become pale pink and firm and not bleed anymore. One of the worrying things, I think, is that when somebody has got gingivitis and you start to brush effectively and properly, and that's where the teeth and the gums meet, then for the first 3 or 4 days, the gums seem to bleed more. They're not bleeding more, it's just that you're brushing in the right place. And eventually the bleeding will stop, and that's a sign that you know you're getting it right. If you do find when you brush somebody's teeth, everything's fine, and then you notice a little bit of blood, you need to work out where that blood's coming from, have a good look around, and do some more thorough brushing in that area. The bleeding is a sign that you're missing somewhere. Over time, what can happen is the gum disease can turn into what dentists call periodontal disease. And what that means is disease of the supporting structures of the teeth. So that's the bone and the fibres that hold the teeth firm in your mouth and stop them from falling out. The reaction of the body to the plaque is that this supporting structure gets destroyed, and over time the teeth loosen. You may get a gum abscess, periodontal abscess is what dentists call that. It's very painful, and the teeth will get looser and looser and either have to be taken out because they're painful or just fall out on their own. And some of you may know clients where that's happened, and that's a terribly sad story for something that's very preventable. Attrition or abrasion, they're subtly different, but the effect is the same, means loss of tooth surface. So the teeth, in effect, are being ground or worn away. That can be caused by grinding habits. That's the commonest one. Many of you will have clients who grind excessively and they will wear their teeth away. There are, in certain cases, anti-grinding appliances that can be made and fitted for your clients, but they are quite specialist things, and again the dentist has to make them. Dentists call grinding bruxism, and it might in some cases be a sign that something's wrong. Some people grind their teeth, they've ground their teeth all their life and it is just a habit and it's nothing more than that. Other people will grind because they're stressed or worried or anxious or unhappy, and if their grinders already and their grinding pattern changes, you need to ask yourself why. If they've never been grinders and they suddenly start grinding, look for those things, look for worry and stress. But the other thing that can cause grinding or bruxism is pain. And if the patient, or if my patient, if your client has pain, which may not be in their mouth, it might be somewhere else, it might be an ear, it might be a tummy, they may well grind their teeth, and that could be a sign that they have got pain somewhere. The third and increasingly common problem that people have with their teeth is erosion. And what that means is that the enamel is being dissolved away from the teeth by acid, and that's usually acid drinks, but it could be acid from the tummy for people in acid reflux or people who have bulimia, or it could be, in very rare cases, occupational, where people work in an acid environment. It's very uncommon. Erosion is a really serious problem because first of all the enamel wears away and then the dentine wears away. Once the dentine is exposed, the teeth become very sensitive and painful, and the nerve may even be exposed. If that person has erosion and grinds their teeth, abrasion, then it happens very, very fast. Now, the commonest sources of acid in the mouth are drinks. So any form of fruit juice which will have citric acid, any form of fizzy fruit juice or drink will have citric acid and carbonic acid. Some of the drinks that you'll buy in the supermarket in all sorts of different flavours and colours will have phosphoric acid in them, as well as citric acid, as well as carbonic acid. It's the carbonic acid that makes the bubbles in fizz, and they're even worse. Basically, the only safe things that you can drink frequently on a regular basis are water, milk, tea or coffee. Other things are just not safe. A glass of fruit juice once a day with food, preferably either in the morning, at breakfast or at lunchtime, will not hurt them and is good because you're getting the 5 a day in. At other times it's really dangerous. The worst time of all is last thing at night. You shouldn't really brush your teeth within half an hour of having an acid drink because the acid softens the enamel and it's very easy to brush off the layer, and it happens even faster if you do that. So if you are having acid drinks and you want to do a quick restorative procedure, is you can rinse your mouth with a fluoride mouthwash or get your clients to rinse, or rub some toothpaste into their mouth with their finger or your finger. That's okay, but even so, avoidance is best.